All right, everyone. So thank you so much for spending time with us tonight. So we're going to be talking about mental health today and the impact of physical health on mental health specifically. I'm Stephanie. I'm one of the co-founders and co-presidents of Invisible Illness Awareness Network. I'm a white woman with long brown hair. I'm wearing a gray blazer and a black shirt. And we do have some disclaimers tonight before we get into anything. Please note that none of what we're saying tonight is medical advice. So please consult your doctor if you have any medical concerns. And please note that each person with a condition is unique. Even among people with the same diagnosis, there's often spectrums to these conditions we're talking about, and not everyone is the same. And please also know we are not experts on these specific topics, but our guest speakers are experts on their own personal experiences with these conditions, and we have done some background research.
My name is Morgan. I am a white woman with long, dark brown hair. I'm wearing a blue t-shirt right now. So as Stephanie said, I'm just going to provide a little bit of background about our topic for tonight. So firstly, to discuss mental health and chronic illnesses, they are very closely linked. Often living with a chronic illness is emotionally exhausting, and that can increase your risk of developing a mental health condition. People with invisible illnesses are often misdiagnosed as well, saying that they have a mental health condition when there might be something physical going on, or in addition to their mental health conditions. Medical gaslighting and systematic ableism and stress can worsen symptoms, as well as create barriers to care that can particularly exacerbate mental health challenges as people aren't seeking the help that they might need. Mental and physical health can often coexist, and both of them need care and understanding separately and about the way that they interact with each other. Well, now I'm going to go ahead and hand it back to Stephanie to introduce our guest speakers for tonight. And yeah.
All right, thank you so much, Morgan. We have two lovely guest speakers with us tonight, volunteering their time to share their thoughts and experiences with some of these conditions. So first we have Lyric. They go by they, she pronouns. They're a chronic illness and mental health advocate, and you can find them at The Bedazzled Spoon on Instagram and at Lyric Reigns on TikTok with two N's in there. And then we also have Kaleigh, who goes by she, her pronouns. She's a patient advocate and content creator, and she goes by at chronic.kaleigh on Instagram, and that's Kaleigh spelled Kaleigh. So if you guys both want to do a brief introduction of yourselves beyond that, and a verbal image description, that would be very much appreciated. And again, thank you so much for your time tonight.
Thank y'all for having me. Hi, I'm Lyric. My pronouns are she, they, and I am a light-skinned African American femme presenting person with about shoulder length threads, a light blue headband, and a white shirt. I also do have autism, ADHD as well, and I am queer and part of an LGBTQ choir that I spend 1 to 2 days of my week in. Um, and yeah, I am a tenor, so that's what I do in my spare time usually.
Hi, I'm Kaleigh. Thank you so much for having me. I use she, her pronouns, and I'm a white woman with long brown hair wearing a pink shirt. I live in Chicago currently. I moved here in 2021 for my master's degree in opera. I actually have a Bachelor of Music and a Master of Music in Opera. So I like to be in front of people. Unfortunately, I haven't been able to do too much singing or performing because 2022, I ended up becoming very chronically ill. So that's a work in progress, getting back to it. But I post on TikTok and Instagram about my experiences living with chronic illness and mental illness, and try to help others figure out how to navigate the medical system and the diagnostic process. So thank you so much for having me.
Of course, thank you so much for being here. All right. Well, without further ado, we'll dive into our first question. Could you both share your experiences with living with an invisible illness, a chronic illness, or disability, especially relating to today's topic? Things you might want to talk about. When did you start experiencing symptoms? What symptoms do you have experience most often? And maybe a brief description of how your condition affects your everyday life.
So I have a couple of chronic illnesses. I will spare you the entire alphabet. I'll talk pretty much just about my POTS, which stands for Postural Orthostatic Tachycardia Syndrome, because that's the one that affects me the most on a day-to-day basis, and we're still trying to really get under control. POTS is an autonomic nervous system disorder, And the autonomic nervous system regulates the involuntary responses of the body. So things like heart rate, blood pressure, respiration, digestion. So when you have POTS, your nervous system is dysfunctional, meaning all of those body systems are dysfunctional. Um, so I deal with symptoms like tachycardia upon standing. That's the hallmark with POTS. Lightheadedness, dizziness, excessive sweating, a lot of GI issues. It really affects the entire body. So I first got sick in March 2022, and I started just having like lightheadedness and dizziness. So I figured I must be having like low blood sugar episodes. But then I started fainting, so I went to my primary care doctor, and that kind of started the beginning of 20 months of being passed from specialist to specialist, trying to find answers, trying to find the doctor that could help me. I ended up seeing upwards of 12 specialists, including having to go seek care at Cleveland Clinic, out of state. At one point, they thought I might have a neuroendocrine tumor. And so they had me do a urine jug, and that was the start of my posting on TikTok and Instagram, and like how I kind of became a creator and an advocate because they lost my urine jug. It's like a bright orange urine jug. And so they didn't know where it went. And so of course I turned to social media to say, has this happened to anyone else? And I don't know what to do next. So then that's how I got posting on social media and started connecting with people and becoming an advocate. And then 20 months after getting sick, I was finally diagnosed with POTS. It was my, oh wait, I'm just going on and on about POTS, aren't I? Wait. Can you ask the
It's totally
question
okay.
again?
It's
So, yeah.
we are talking about how chronic illness and mental illness do relate. So it gives some
Okay.
background to what you're experiencing and how it kind of, impacts each other. So
Okay. Sorry.
the question was basically giving background, like things
Yep.
like when did you start experiencing symptoms? What
Right.
symptoms do you have? How your
Okay.
condition affects you. So that these intertwine. So that's okay.
So I'm on the right track. Okay,
Yeah.
sorry. Brain fog. Thank you, chronic illness. So yeah, so when you're living with an invisible illness, especially one that's not super well known or researched, and there's really not too much that they know like how to treat it yet. There's no cure. Of course, that brings a whole host of barriers, not just in getting diagnosed. I had to see so many doctors because a lot of them had no idea what it was. And that led to a lot of gaslighting. It led to like, you're not sick, you're just anxious. I can't say how many times I heard, you're just anxious. Like, you're making it up. You need to see a therapist or you need to see a psychiatrist. And so that definitely had affected my mental health as I was going through it because when what you're going through is impacting your life and disabling you, like, and no one or very few people, especially professionals who are supposed to help you, will recognize that, it can be so damaging. And I'm very fortunate that my bipolar disorder has been really well managed since I was diagnosed in 2017. We pretty much, like, once I was diagnosed, put me on a medication, and I've been on that medication to this day. It's been like almost 10 years. And we've had to play around with other medications on top of it, but for the most part, I've been pretty stable with my bipolar. Navigating the medical system and the diagnostic process with OCD can be really challenging because OCD is like the constant search for reassurance. So when you are constantly searching for answers and pursuing answers and trying to figure out what's wrong with me, like they overlap so heavily. And that turned into me continuing to navigate the medical system, like feeling like I was just on a hamster wheel and I had to keep running. Um, and and pushing on while I was burnt out. And because I would always think, well, maybe it'll just take one more. My OCD brain was saying, maybe just one more doctor, maybe one more appointment. And so that affected and continues to affect how I navigate the medical system. And now that I'm diagnosed, like my treatments. So I definitely feel like it's mostly my OCD that affects how I move through the world right now because I'm fortunate that my bipolar is like mostly stable and well managed. But living with invisible illnesses, especially ones that are under researched, complex, also like overlapping with a lot of other conditions. It's like almost never POTS. It's usually POTS and dot dot dot. So navigating all of that when it's all invisible is really, really challenging.
Thank you for sharing. Lyric, do you want to talk about your experience with symptoms that you have and how your conditions affect you?
Yes, absolutely. So, for when I started experiencing symptoms, for depersonalization-Derealization disorder, that must have started, it couldn't have been later than ages like 10, 12. I couldn't have been in my teens yet. So I was always, because I don't remember the majority of my life until I hit like 16 plus. So then it starts getting pretty clear, but even so, I still have trouble remembering my day-to-day life because my brain isn't really turned on. So for that, and then for PTSD, I started experiencing symptoms that probably was younger than I remember too, because I was bullied a lot and went through other things in my childhood, adolescence. But it was really prevalent when I turned 23 and went through a lot of things since no one should really go through. So, um, how it affects me, especially with chronic illness, is my most prevalent one. I'll just say one is vestibular migraine. So think of migraine. Yes, I do have your typical like migraine pain, migraine attacks, whatever, like head pain, one side head, all around, whatever. But the vestibular portion means I'm dizzy. I feel lightheaded, and it messes even more with the depersonalization, derealization a lot because I can't focus on anything because I'm trying, if I'm going to focus on anything, it's to make sure I'm not falling down. So, how it affects me on my day-to-day life, I'm dissociated to some degree 24/7. The only time I'm not is if I'm doing something that completely requires my full attention. Luckily, I can still drive in small increments. Luckily, I can still like do like hang out with my friends or something. But if I'm at home, it's hard for me to even remember to look at my phone if I'm not doom scrolling because I can, if that's a mindless task, but texting, calling, that requires brain power. So I have to deal with that. And the hardest thing right now is just, not being able to be present and fully there for my friends much as I'd like to be. Because I'm either down with my vestibular migraine or I'm down dissociating, staring at a wall in the corner somewhere. So um that in terms of PTSD, I wake up anxious most days because even though I don't remember what nightmares I've had, I'm assuming I'm having something going on. And I'll grip the sheets at night to the point where I also have mixed connective tissue disease, which is autoimmune. So, someone with arthritis who's constantly gripping their hands, that's not going to feel very good waking up in the morning after however many hours you're doing that. So I deal with like hypervigilance. I'm always feeling watched. I have occasional flashbacks and things of that nature. But yeah, DPDR is definitely more effective, affecting my life more so. And it's just hard to be able to focus on anything. I feel like everything is unreal, foggy, blurry. Like sometimes I feel like I'm watching myself, sometimes I don't. And then the most one is just feeling like I'm in a simulation. Like this isn't real. I don't know what I'm doing. I don't understand what I'm doing. It's really silly. So it feels silly. I know it's not, but it feels that way sometimes.
Thank you for sharing that. That does sound challenging.
The connection between your vestibular migraines and your mental health is a very interesting point. So both of you touched on this a little bit, but if you have anything else to share about how your day-to-day life has changed since your symptoms started. So you might want to talk about like what challenges do you face in your day-to-day life, what your condition has taught you about yourself, and has it influenced your self-view or identity in any way?
And within that, if you want to tell us about your journey to getting diagnosed, I know both of you kind of touched on that too, but that can kind of tie in as well.
So I was diagnosed with bipolar disorder in 2017. I was a junior in college, but I was experiencing symptoms for many years before that. The earliest I remember experiencing symptoms was as a freshman in high school. And my mom took me to the doctor because I was experiencing like massive depressions, but also so much irritability. I was aggressive, I was angry. And like looking back now, I can see that I was also experiencing the highs, but I also like have always been very confident and outgoing, and I'm a performer, so I've always loved like being in front of people and like being the life of the party and making people laugh. And a lot of those things in my episodes and my hypomanias or manias are just super elevated. So at the time, I think it was hard to convey to my doctor that I wasn't just having the depressive episodes, but also that I was experiencing the highs. And because of that, I was misdiagnosed with depression. And I even remember my mom asking in the appointment, like, do you think she could have bipolar disorder? And she's like, no, 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 no. She's too young. Like, definitely not. So I was put on an antidepressant, and throughout high school, I was on an antidepressant. And for a lot of people with bipolar disorder, antidepressants can actually be like one of the worst and like destabilizing things for you to be on. Um, and that's because most antidepressants, especially like tricyclic antidepressants, SSRIs or SNRIs, work by elevating neurotransmitters like serotonin or epinephrine. And bipolar is treated with like mood stabilizers and antipsychotics to stabilize those neurotransmitters. So when you're taking medication to elevate them, that can very easily put you into either a depressive episode, but typically it'll be hypomania or mania, and that's definitely been my experience. And so by the time I went to college, I just kept saying, my medication's not helping me, my medication's not helping me. And my primary care doctor actually would just like increase the dose. Like I wouldn't have to go see her. She would just be like, okay, let's increase it. Let's try. And then eventually I just ended up having like a total meltdown. Like I could not shower for like or get out of bed or go to class or really do anything. I couldn't take care of myself for a couple of weeks. My family grew very worried about me. My mom and my sister came and like stayed with me at school. And then finally my mom like was calling, got me into the psychiatrist at school. And the diagnosis came very easily after that. Like the psychiatrist like took one look at me, did all the like the testing for bipolar, which is usually just a bunch of surveys looking at your mental health history, and actually diagnosed me with bipolar 2, which was later updated to bipolar 1. Um, and as I said, I was put on a mood stabilizer, which I have continued to be on. And my bipolar disorder has been pretty stable, except for when we have tried to treat my OCD, which has been the biggest challenge because a lot of times the first line treatment and what can a lot of times be most effective is taking antidepressants, SSRIs, SNRIs for OCD. And when you have bipolar disorder and those things can like so easily trigger you, that can make treating OCD so challenging. Like I'm so sensitive to these medications that I'm currently taking, like I call it cat Prozac, which is an antidepressant, but I have to take the liquid and like the cat dose. So we're trying to slowly see if that will help, manage my OCD in any way. And we're having to take it so slowly because in the last several years that we've been trying to treat it, we've tried probably 8 or 9 different antidepressants, and all of those have either pushed me into a mixed episode, which is where you're experiencing symptoms of both like the highs and the lows. So for me, I get a lot of like irritability, not so much the depression, just like irritability, agitation, and then still like the restlessness, the extra energy you don't know what to do with. Um, and then my OCD diagnosis came in 2019, so about a year and a half after my bipolar disorder diagnosis. And like my OCD didn't get really bad until, shocker, the pandemic. One of like the hardest things I struggle with my OCD is contamination OCD. And that definitely not only affects how I move through the world, especially in the medical system, going to all of these like hospitals and doctors' offices where people are going there sick, but also because my health is already in such an unstable place. And like even just a simple virus, like the thought of getting a virus, it's just like can't imagine how sick I would feel, let alone getting something like more serious like COVID, which is still disabling people and killing people. And so my OCD side of things definitely overlaps so much with my health and like the state of my body and my chronic illnesses. And it was really triggered by health anxiety because of COVID. And then the other side of my OCD as well is like I have a thing about fires or anything about my cat, but specifically fires. So, like you had mentioned in talking about OCD, that um, some common compulsions are like the checking. Like, I will check and check and check. I will have to have pictures of all of my outlets because if I unplug them, I'll be like, okay, I unplugged them, and then I'll be out the door and be like, but did I actually? So I will have to take photos of my like empty outlets to say like, oh, okay, great, I did unplug it. And also the same thing, like the stove was mentioned, making sure that the stove is turned off, making sure I haven't used the oven. And that's like less so to do, obviously, with my illnesses, but the contamination OCD part definitely overlaps there a lot.
I have a quick question before we move on to you, Lyric. Do you happen to you just talking about the differences like for the SSRIs and like being on the wrong medication in high school and whatnot, did you find that your OCD was more under control when you were on that? Just out of curiosity, like or was did OCD did you have those kinds of symptoms in high school still, or was that something that developed more like in college and afterwards?
Yeah,
Um,
I think my OCD, I feel, started in college because, and it started around also like illness and germs. And I think that started to happen because, like, when I went to college, I was finally like singing in full capacity. Like, I was there for singing and performing. So I quickly learned if I got sick, I could not do my schoolwork. Like, if you're sick, then your vocal cords are inflamed. You don't want to risk injury. So that was kind of how it started, me like having that realization and then taking precautions to keep myself healthy. And then like that just becoming more and more extreme. And then when COVID happened, it was really like the nail in the coffin that just like sent it like fully spiraling. Because I was diagnosed in like June 2019. So like officially diagnosed with OCD about like 8 months before the COVID-19 pandemic started. Um, yeah, it started slowly in college. I don't remember ever experiencing that kind of stuff in high school. I have to ask my family. I don't know if they feel differently. Well, I don't know. I can keep you posted on that one. Oh, and then sorry, also, um, I wasn't ever really on the antidepressants long enough to see or find out if they helped my OCD, you had asked. Because like I would respond very quickly to them, in terms of like my bipolar disorder. Like I was on one medication last December for like 8 days, and I was in a mixed episode. So I was never able to be on them long enough to know like if it would help my OCD or not. I think the longest I was able to stay on one of them was like 17 days or something. So it was never long enough for me to know one way or another if it would have helped.
got it. Thank you. Lyric,
Sorry,
you
I was
next. What do you want to
reading
talk
and
about?
making, I was trying to
Mhm.
remember.
No, that's fine. Do you want me to
So,
repeat
uh,
anything?
sure, just in case, just to make sure.
Sure. So Sarah was talking about like how your day-to-day life has changed since symptoms started. How has your life changed
Mhm.
since you got a diagnosis? And that can kind of tie into your journey of getting diagnosed and what that looked like.
Sure. So, my day-to-day life, pretty similar. Like, I can't, well, similar to what I said before. So, like, just feeling foggy and out of it. The only difference now is I know the name for what I've been dealing with because I just don't feel much of anything unless it is such a big, crazy thing like a death, like going to like a concert. Two of my choir friends and I went to a concert last month. I was able to be present for that because it's loud, it's a lot of lights. It's a lot of sensory input that just cannot be ignored. So things of that nature will kind of snap me out of it very briefly. But in terms of getting diagnosed, I don't remember in a crystal clear manner for PTSD because I was just so out of it. But I was seeing my therapist after dealing with unsafe situations. I wanted to get started with EMDR, but I was like, okay, this probably wasn't a good event. I was thinking that I didn't have like textbook trauma. I don't like to use it because people already complain about the word trauma being thrown around. So the last thing I wanted to do was use that word and be accused of attention seeking or whatever the case may be. So, when I thought I was just, kind of upset over it and just having a hard time, my partner brought up having PTSD, and I said, no, I didn't really go through trauma. I just went through a hard time. It is what it is. But then my therapist, a couple months into EMDR before she left and my insurance changed, she was like, oh, I actually diagnosed you. So either I completely didn't remember that, go figure, not surprising, or, it just didn't happen. And I was just shocked. I was like, no, that can't be right. I know people with PTSD, they have horrible flashbacks. They have to avoid everything. They have to do this. They have to do that. I was comparing myself. I was in a state of denial. I went through the 5 stages of grief because it wasn't just what I went through in 2023. It was also what I went through in childhood. So I really was in denial. I was like, there's no way that's considered trauma. That's just bullying. Bullying trauma, really? It's very much as trauma I learned, but it was just crazy. And then DPDR was during a DBT program. I left due to the group like not being able to sit through group therapies because unlike one-on-one like normal talk therapy, you're constantly talking back and forth. It's harder for me to be dissociated from talking to somebody at all times or listening at all times. But in a group setting, when you're going around the room and saying your experiences or whatever, it's so easy just to be like, nope, I don't know what's going on. I don't care about what's going on or whatever. And I just knew for a while, the past, I want to say year or two, and this just happened this year, by the way. I was just diagnosed a month or two ago. So for the past year, I knew something was deeper than just a trauma response like the therapist I was doing EMDR with. I just knew already, but that's pretty much how it was. Both were pretty unexpected. When it came to like autism, ADHD, while I was diagnosed at a very young age, I had special interests in mental health and medications anyway. So I was completely like, okay, I probably have this. It's fine. It is what it is. I had plenty of time to accept that, and it was fine. But with this one, it was just a complete shock. And my journey, honestly, dealing with, getting depression, anxiety, whatever, tons of medications thrown at me. I sat down a couple weeks ago and counted 20 different mental health medications, depression, anxiety medications, sleep medications, uh, totaled in 20. And I did the gene site testing and everything. Nothing worked. If anything, it made me worse because the one of the hugest side effects, even with someone who medication does work for really well, you'll hear, them say, I was depressed and now I'm so numb, I can't feel anything. So imagine putting that to somebody who can't feel anything at baseline. Absolutely terrible. I'm personally, I'm like, I can't, I told my psychiatrist, I can't be on anything anymore. Like, can I please be under really close? I cannot stress this enough because people will just stop taking medications. Do not do that. I was like, can I please be under close supervision while I'm doing therapy and stuff? And he was like, that's completely fine. If anything, I'd rather you be able to be fully present as much as you can because you're right, that is a very common side effect in mental health medications in general, let alone somebody who has the numbness and being out of it as a disorder. So I remember being on Prozac at the age of 9 because I was so depressed from being bullied. But I just needed therapy the whole time, honestly. I needed to talk it out. So
That makes sense. Thank you for sharing that. So that kind of ties into our next question, which is what approaches or treatments have you tried? What's worked and what hasn't worked for you? I know you both have kind of touched on this a little bit. Kaleigh, do you have any other thoughts on that? You don't have to list all the things that you've tried. We don't want Lyric going through all 20 medications. But what's been the most impactful, both good and bad? What are things that stand out to you?
Yeah, I think specifically in terms of my OCD, um, because a lot of times bipolar disorder and OCD can be comorbid. And so it's not that all people with bipolar disorder don't tolerate antidepressants. A lot of the time, people who have bipolar disorder can very successfully treat and manage their OCD with antidepressants. It's usually done by stabilizing the bipolar disorder first with a mood stabilizer or antipsychotic, and then adding the antidepressant. So the mood stabilizer or antipsychotic can make sure that those neurotransmitters are stabilized, and then slowly introducing the antidepressant. Um, and we have tried that with a bunch of different antidepressants, the SSRIs, SNRIs, tricyclics. And the thing that's different this time is that I am on a maxed out dose of a mood stabilizer and a maxed out dose of an antipsychotic. So we're hoping now that I have both of those together and we're starting super low with the antidepressant, the Prozac, that hopefully those two medications together will be enough to balance out the introduction of the antidepressant. So for a lot of people with bipolar disorder and OCD, it is possible to manage and keep both of them pretty stable. It just often takes some tinkering around with medications, pairings, more dosages. And then I've been in therapy for a very long time for OCD. And we kind of hop around between CBT, DBT, like I've tried EMDR, that didn't really do that much for my OCD, and even like exposure and response therapy. Um, and there's only so much you can do in therapy. And I have kind of reached that point with my OCD that really, like, logically, I know I'm like, I realize it's crazy that I need to call my mom every night to make sure that she doesn't die because I don't call her. Like, logically, I understand that that will not happen, and that if I don't call her, that like she will be fine. But even so, it still goes in my head every single night until I call her. And then like, okay, I can finally go to bed. Um, so for some people there really is. And for me, especially, it's like there's only so much you can do in therapy. And then sometimes you just need more assistance. So I'm really hoping the medication for my OCD will work.
Real quick before we move on, if you're able to like sort of briefly define the different things, so like CBT, DBT, and EMDR. No, that's totally okay too.
Sure. So CBT is cognitive behavioral therapy. I've probably done the most of that. And that is mostly, I feel like it's kind of controversial because a lot of people view it as like gaslighting yourself. It's very much like mindfulness focused and challenging the thoughts that you have, which I think is why a lot of people feel that it's just like gaslighting yourself. So like something that like my therapist would like have me say like, oh, what if I don't call my mom tonight and she dies? And then they say like, well, what if you do call your mom tonight and she dies? And it's like, oh, well, that's not super helpful, but I see what you're saying. So it's kind of like challenging the harmful thought, sometimes with a question that like could feel more distressing to you, or sometimes it could be like, well, what if this terrible thing happens? Well, what if the terrible thing doesn't happen? And so that was kind of like how I have gone through and like my understanding of CBT. DBT I did very briefly, and the same for EMDR. So I'm probably am not the best person to define those, to be completely honest. And then exposure and response therapy is like exposure therapy for contamination OCD. So it's like I've had to do like, why don't you go touch that public doorknob and then don't wash your hands for 10 minutes, which is like a nightmare for me. Um, so exposing yourself to the distressing thing and then sitting with that distress before, like, instead of immediately going and doing the compulsion, which would be washing my hands.
Thank you for that.
I can touch a little bit more on DBT and EMDR. So yeah, DBT is dialectical behavioral therapy. The difference between CBT, which was a wonderful description, DBT is a little different. It kind of teaches. It's more of a, like a in my experience. It's more teaching skills. So there's like four different classes. There's like emotional regulation and things of that nature. Like they'll teach you ways to regulate yourself basically. It's like a huge book. It has to be at least 400 pages of different skills you can learn to regulate yourself, to cope with the things you've gone through and things like that. It was originally created for people with borderline personality disorder, but it really works for anybody who's really trying to improve like their life and learn different skills. Um, it can help someone with depression, anxiety too. It is very helpful for for certain people, not everybody, of course. It's not a one size fits all. And then EMDR stands for eye movement desensitization and reprocessing. So the way I did it was I did it virtually because I was really having a hard time with my chronic illnesses at the time. So I really couldn't leave the house. But the way my therapist did it, it's kind of a form of hypnosis, but it's not. Like you watch for me, I watched the ball go back and forth for like it couldn't have been longer than 15-30 second intervals because the goal isn't to hypnotize you, but it's to like I can't really describe it fully. But she would stop and be like, okay, what are you noticing? Like she would tell me to think about the traumatizing event and what emotions came up, what feelings came up. Um, so yeah, and me personally, the the journey was I wanted to also mention I was actually misdiagnosed with BPD and bipolar at one time because the way I processed dealing with the dissociation were not harm were could have been seen as impulsive things. But the way I really explained it to my psychiatrist is, well, this isn't exact. Well, he explained it to me. He was like, going out to concerts, going out and doing things like that, and trigger warning, self-harming just so I could feel something. Wasn't necessarily like, sure, that is a classic BPD symptom, but along with everything else I was explaining, the absence of those other like, there's a total of 9 symptoms. I only had like two, and you need like 4 or 5 to get diagnosed. So he was like, no, you have a feelings of emptiness, but this is because of this. So that completely makes tons of sense. So in terms of treatments, I tried CBT. I am currently in individual therapy with a therapist who does both CBT and DBT, so I don't have to worry about dissociating during group. And EMDR, I am wanting to go back into next month now that we know this is due to trauma. But I have to make sure that because there's a certain part of EMDR, they have a dissociation protocol that I wasn't doing the first time. So it was helpful to some degree, but if I was particularly having a foggy day, nope. So luckily, my psychiatrist who did my psych eval 2 months ago, he knows the dissociation protocol, so I'd actually get some benefit from it this time. So.
Nice. I hope you do get the benefit with it. That sounds promising.
And real quick, I realized I never introduced myself and did a verbal image description, so apologies about that. I am Sarah Hammis, the other co-founder and co-president of IIAN. I am a white woman with short brown hair and glasses, and I have a bluish shirt on. And then we'll move on to our next question. So what challenges have you faced within the healthcare system, education, or workplaces in terms of support or lack thereof? And specifically about that, do you feel that your mental health diagnoses have impacted how doctors have treated you, both for your mental health and for your physical health?
I would say I've been very, very fortunate that I don't feel like my bipolar or my OCD affected my schooling. And before my schooling, like I didn't ever really work, like not a actual like big girl job, you know. And so I was able to get accommodations based on my chronic illnesses in grad school. Um, and which certainly helped with the worsening of my OCD. But the accommodations were definitely more so for like my fatigue and like being able to leave early or like attend virtually instead. So I'm very fortunate that I haven't faced a lot of barriers in that regard. In terms of how my doctors have treated me, or like navigating the medical system, I was more so dismissed with anxiety than bipolar or OCD because I was always very, very careful in my appointments that were about my physical health to not mention my bipolar or my OCD at all. And so a lot of times, like it didn't come up in conversation. I don't know if they like didn't look at my chart to see those things or if they just didn't feel they were relevant. But every time that I was dismissed or gaslit, it was blamed on anxiety, rather than my bipolar or my OCD. I will say it has affected how they treat me because a lot of times, or like physically, how they treat my health. Because I've definitely there have been times where I've had to say, I can't take that because I have bipolar disorder. Like, there are several antidepressants that at lower doses can be really effective in treating chronic pain, especially like nerve pain, nerve sensitivity, like amitriptyline. And I was actually put on that and I didn't say anything that I didn't say like, oh, that might be a no-go for me. Like I have bipolar disorder. And so I started it and naturally I went into a hypomania. So after that, I was like, I cannot do that again. I have to, like, even though I am afraid, they will like potentially dismiss or gaslight me or say like, oh, well, there's the problem, your bipolar disorder or your OCD. That like once that happened, I then if my like my GI doctor, for example, would be like, oh, how about we try this antidepressant at a low dose for this nerve sensitivity? I would be like, I can't do that. And so then she would have to like kind of think outside of the box for other treatment options since those like weren't available or like weren't the best idea for me.
Yeah, that makes a lot of sense. Thank you so much for sharing. And I definitely know a lot of antidepressants are used off-label for so many things, and I'm sure that puts you in a very vulnerable and tricky position of, obviously wanting the right treatment for you, but then not also wanting this new condition to them to influence how they perceive it overall. Thank you so much for sharing. Lyric, if you'd like to go next.
Sure. So for me personally, I barely made it through school and grade school. I'm surprised. I'm still surprised. I still ran into my high school diploma and actually am genuinely surprised I even earned it because I don't remember the majority of K through 12. And then when I tried to go to college, no go. And unless it was like medical terminology, I managed to get an A in. I mean, autism special interest, I could have done it in my sleep potentially, not to toot my own horn. But I was like, okay, great. I enjoy this. This is fun. This is great. I already know the majority of these words. That's fine. But then I move on to say anatomy that's really heavy on memorization. That's really heavy on every just memorization really, and I could not do it. I've withdrawn from it every time except for like because here I had to do like lab and a lecture. The lecture is a little better, but the lab, no, because you had to physically point out every tendon, every muscle, every bit in the skull, every bone, every this, every that. So I was able to manage 20 to 25-ish college credits, but that's not enough to get a degree. And I tried ADHD medication. I've been on throughout. I tried like two in high school and then two recently, and it just makes me the data does nothing, makes me feel worse, triggers my migraine attacks, etc. So, and then as for working, I currently can't hold a job. Had I have been approved for SSDI after three denials. So, because when I go to work, I end up making silly mistakes. I was tardy or absent and just not being able to be focused or do the duties of a job. And I've tried so many things. really is devastating because I do miss being able to go out because growing up I like to isolate myself, but nowadays no. Like back then I would have never, except like for band, because I was a band kid back then, but now I'm in choir. But for band, I was fine doing solos. And then now in choir, I'm fine doing solos again because I don't mind being in front of people now, but back then could not stand it. But the best thing is for me is being around people because it's harder to dissociate around people. And plus I just like getting to know people anyways. So, and as for dealing with doctor's offices, not really for my mental health aspect. Getting this diagnosed with vestibular migraine was a challenge. They tried to blame that on my anxiety and my ADHD of all things. Okay. So that never ceases to make me go, what the heck? But other than that, yeah, I haven't really faced like discrimination or problems in terms of my PTSD or DPDR exclusively. It really rarely comes up in the medical setting unless someone really is like, we really want to know all of it because I'm not really on medications for it, so it doesn't really come out. So
That makes sense. I'm glad you haven't experienced that. That's good, but it makes sense with what you said.
Alrighty, so I'm going to go ahead and pivot into our last question here to kind of wrap things up. So I know we talked about a lot tonight, so this one's probably going to be a little bit of a tricky question, but what misconception, if you could choose any about your condition that you've encountered, would you like to challenge the public to think differently about? And it doesn't have to be the public in general. Maybe it can be doctors, maybe yeah, it could be the general public, but what is one thing you really hope that people can kind of take away that if you could have one message, what would that be? And try to keep it to a couple sentences or so.
So I'll do my bipolar and my OCD. For bipolar disorder, I would say there's a misconception that the changes happen so rapidly. Like people say, "Oh, the weather is bipolar. Yesterday it was this and now it's this." When really most of the time for bipolar disorder, like if you have bipolar 2, typically your episodes are shorter, so like 4 to 5 days sometimes. Or if you have bipolar 1, they can last months. And then the second part of that is also like there's this misconception that people with bipolar disorder are dangerous. I think that's attached to the misconception that the changes happen so rapidly. But people with bipolar disorder are able to lead and live perfectly happy, healthy, stabilized lives. And then with OCD, I'd say the misconception that it's just a preference for like neatness or perfection, or like I like my highlighters organized by color. Or even that like, oh, everyone with OCD is a germaphobe. Obviously, there is much, much more to OCD than that. And, it involves severe time-consuming distress. So, yeah.
Yeah, thank you for that. And I think you touched on a couple of similar points in both of those responses about people using serious mental health conditions as like some general, like, oh, yeah, I'm so OCD, like I like to be organized, or yeah, the weather's bipolar. And I think that speaks to the greater issue of people not understanding like how much these conditions can actually impact people's lives, but then also to the point as well of you can still live life with these conditions. So thank you so much for sharing. Then Lyric.
okay, so the first one I could easily come up with for PTSD is it's only for like veterans or so you had to have gone through something serious because I had to learn that second one. I was like, oh, there's a lot more that meets the criteria for trauma that you would think of. It doesn't have to be a car accident, it doesn't have to be going to war or things like that, or even like things like assault. Um, which I've had my experience of that too, but usually people are like, oh, I thought that was only for veterans or whatever the case may be. And I'm like, nope, never been into war. Uh, do not meet the qualifications for the military anyway, but um, that's the main ones for PTSD. And then for DPDR, I actually came up with just yesterday because I ran across this. Someone on TikTok for someone talking about dissociation was like, oh, it must be nice to not have to deal with all these emotions or memories. Look, the things I can remember, this is what I think I told my partner this, or maybe a friend. I was like, the thing I appreciate being able to remember the bad stuff because at least I can face it head on. I can deal with it. I know what's causing this. Whereas missing the years of, like, I know you go through years of what they call infantile amnesia. You're not going to remember the first 3 to 5 or sometimes even 7 years of your life. But past that, it's like, okay, where are my memories at? Something could have happened that I have no idea, and I'm dissociating being out of my body trying to avoid it. I would argue, comparing to the stuff I do remember, it's a lot scarier to think about what I don't remember. It's way more terrifying in my opinion. Everyone's opinion is different, but in my opinion, I would just challenge people to be like, it's much better to at least be able to face it head on. Like, sure, depending on what you go through, there's some nuance that you might have to add there. Completely understood. Like some people, like, I wish I could forget what happened to me, and I completely understand. I have PTSD for myself, but I shouldn't be crying in my kitchen because I can finally cry because I can finally process my emotions after stuffing them down for the first two-ish decades of my life. So it was really, I was just like tears of joy. Okay, I can cry, I can feel things. I'm not emotionless. I can feel things. So what I would challenge the public to do is remember PTSD isn't for just veterans, and DPDR isn't fun to forget. It's not fun to be numb all the time. It's better to process your emotions at your own pace, yes, but some pace instead of just stuffing it down.
Yeah. I think people kind of fall into the like the grass is always greener on the other side. It's like, well, I would like to experience that sometimes, but having that be your everyday life, it's like you don't really think about what that would be like in someone else's shoes. It's like you need to think about all aspects of the condition and the fact that you can't choose to get rid of it whenever you want. It's not like that. It's something that you're living with and learning to navigate life with. Um, but thank you for sharing that, Lyric. That is a really important point to consider. Thank you both for all of your time tonight. We really do appreciate it and you being vulnerable and sharing your experiences. And I got to know more about these conditions personally. I know I've learned a lot from you both, and I'm sure other people here tonight have as well. So again, you can find Lyric and Kaleigh on their social media on the screen. Um, Please follow us on social media. Our Instagram is invisible_illness_network. We post pretty often about different conditions and various topics each month for different awareness days and months and stuff like that. We also have an Instagram dedicated to the Invisibly Aware series, which is what you're at right now, which is invisibly_aware_series. And in a few weeks' time, you'll find this recording on YouTube at IIA Network. If you scan the QR code on the screen, it'll pop up to our website and our link tree with a bunch of different links, including our newsletter sign up, so you can get email reminders about when our monthly meetings are happening. And again, linking to those YouTube videos of our past presentations. So for June, we're going to be going over different immune conditions. Our meeting date is going to be Wednesday, June 17th. 8 o'clock Eastern time, same link that you're at right now, same time. And in July, we'll be going over neurological conditions on Wednesday, July 22nd, same time and same link as you're on right now. And Sarah put in the chat about 7% of people with PTSD in the US are veterans. I did not know that. I didn't realize it was a very low number. And it looks like Lyric didn't as well.
Something else I'll add too for background about EMDR. So the way it works is based off of the REM cycle of sleep, so rapid eye movement. During that time of sleep, your eyes are going back and forth, and that's when your brain is reprocessing memories and events of the day. And so it utilizes that same structure and that same mechanism to reprocess events in real time, but memories. So I think that's really cool. Fun little fact when you guys are talking about. But yeah.
Thanks for that, Morgan. It's a good reminder. All right. Well, if we don't have any questions, we can wrap up tonight. So thank you again, both of you, Lyric and Kaleigh, for sharing your time with us tonight. We really appreciate it. And we learned a lot for sure. I know I did.
No, both of you talking, like I genuinely learned so much from this discussion. So thank you so much for being here and being vulnerable and sharing your stories. So
Mhm. We very much appreciate it.